When everyone starts rushing over the news of the COVID pandemic or which vaccine got FDA approval, every time one topic always misses the entire discussion table. It's opioid issues. Or simply, you can say fentanyl overdose cases in the US. After hearing this, most of us might have recalled the news of a popular celebrity named Prince who died of an accidental fentanyl overdose at age 57. Apart from this iconic artist, since 1999, more than 538,000 people have lost their precious lives due to opioid overdose in the US, which will cross more than 1.2 million by 2029. You might have seen these types of headlines on YouTube or TV channels. However, do you know in recent times, rather than older adults, more young people have been dying because of fentanyl rather than COVID? Shocking, right? But unfortunately, it's true. In fact, can you ever imagine an opioid that's prescribed as a pain reliever can be responsible for creating an epidemic situation and costing the US economy $1 trillion a year? Moreover, in 80% of the cases, people who use heroin misuse prescription opioids first, which is way more stronger than so-called morphine or abusive heroin. After hearing this, we're pretty much sure right now you may have searched for the alternative opioid option, which has less risk than others. Hence, the groundbreaking part is that whatever the format it is, if you consume opioids for a longer time, your body will suffer many kinds of deadly reactions. In addition, remember we're talking about the opioid epidemic in the US? Yes, this overdosing tendency, improper review, market politics, and aggressive strategies of big pharma companies like Purdue are actually responsible for creating the opioid epidemic in America. Therefore, a recent study by Lancet generates some hope for us when naloxone, a drug that is often given as a nasal spray, shows a promising effect to counteract the reaction of an opioid overdose. In fact, according to a study, an increase in naloxone accessibility is needed in almost every US state to combat opioid overdose issues. So, does that mean this epidemic situation is going to end soon? Or do we have to wait more years to solve this issue?